Now, can you imagine your body being in agony, needing surgery immediately and being turned away at the hospital? Well, that's been the reality of orthopedic patients at Livingstone Hospital in Gqeberha in the Eastern Cape. They're being handed letters explaining they cannot get help as no metal implants are available. The letter even includes the number of the Presidential hotline for patients to call. Denosa Eastern Cape Provincial Secretary Veli Sinqana joins us now for more. Mr. Sinqana, good morning and thank you very much for your time. You know, the situation at Livingston is honestly a catastrophe waiting to happen, if we can't call it a catastrophe already. What's your understanding of the whole situation at the hospital?
Good morning, Fundo and the viewers. Thanks for invite. Really, indeed, the situation in Livingston is an unfortunate situation for the public health sector at large and the patient. Indeed, we are informed that there is a challenge of lack of metal implants in the hospital. And as Denosa, we are of the view that that challenge creates more burden to the workforce, particularly the nurses. And at the same time, as Denosa, as advocating for the patients as well. We do feel for those patients because those people are immobile and at the same time, they need to get urgent attention. You would recall, Mfundo, that Gqeberha is one of the areas with high incident rate, be it a gunshot or the situation of accident, motor vehicle accidents. So those people need urgent attention. So we feel for those people of our community and at the same time for the nurses. The situation in the Eastern Cape is that of the shortage of nurses. We really call for employment of nurses in that area. Specifically, when you talk of orthopedic area, which is the specialty area which lacks the device, the medical device. If I can take you in terms of academic training of nurses in that field, you will find out that at this point in time, the only institution which is Lilita Nursing College do have challenges of the accreditation in terms of orthopedic specialists. Now, orthopedic nurses in the province are even lesser than 100. Then you would ask how many nurses in Livingston dealing with the actual challenge concerning the situation of the shortage of staff and considering that the Livingston Hospital, it's one of the tertiary institutions with influx of patients and the challenge in trauma, because each and every time we do admit patients with different challenges. So really, we are in a challenge in that area. One would ask the situation of how is the department deals with the procurement processes, because if the challenge is now, we believe as Denosa that should have been dealt in a different manner, so that we can be able to have the preventive measures before it happened. As now we can say it's catastrophic.
Now, as ordinary citizens, we may not be doctors, but many know a fractured leg that isn't operated on could lead to a person being disabled. But we hear patients are actually never given transfer letters to go to other hospitals. They're just told to wait or call the Presidential helpline. But is this okay, though? Because they could be transferred.
We don't understand this issue of saying you must call the Presidential hotline. We understand that the department, in terms of the services, as you recall that I mentioned that Livingston is a tertiary hospital, and currently the department is in process to open theaters in other areas so as to assist such burden from Livingstone Hospital. But to write a letter to a patient to say you must phone Presidential hotline, I doubt very much if it's assisting.
But this is, in fact, what has been reported, according to the Daily Maverick, that's what doctors are saying. It sounds, I mean, as though they are also helpless themselves, but it also sounds a bit arrogant to just say to people, we can't help you, you've broken your leg, call the president.
No, that's not fair. That's not fair. That's not fair. And I think they're supposed to have the solution and advise those people correctly.
Now, I saw a statement by the spokesperson of the department saying injuries, just like you say, that injuries due to trauma and violence are on the increase. But he goes on to say this is a societal issue which needs to be discussed at a societal level. But for an ordinary person, when they translate that type of statement, it means we as a hospital cannot be held responsible because you guys are harming each other there in your communities.
No, you can't. You can't take a medical issue and argue that is a societal issue. So if in the society we have a challenge, our responsibility is to render quality healthcare services without arguing that this is a societal issue.
Has the budget been significantly reduced? Because we understand that was the decision taken to reduce it significantly to deal with the medico-legal claims.
The situation of the medico-legal claims, I believe that the department is in process to deal with it. However, we've been arguing that in dealing with the medico-legal claim, without having staff, you will find out that you're going to use more money to litigations instead of employing more workforce in order to prevent the actual litigations. And at the same time,
it's a vicious cycle.
train the workforce to various specialty areas so that you can be able to prevent the actual litigations. Because, for instance, you can't have the situation in orthopedics whereby you have 40 patients, but you do have 2 nurses in a particular ward dealing with those people. And when you get closer to those nurses, you'll find out that it's a professional nurse and the staff nurse. Considering that the responsibilities of the professional nurse are inclusive of the administration as well, then how is that one staff nurse is going to deal? Whereas we do have staff nurses who are unemployed in our communities, who are looking for the jobs. We do have nurses who are unemployed from our communities, of which we can be able to avert such situation.
Mr. Sinqana, thank you very much for your time this morning. That was Denosa Eastern Cape Provincial Secretary Veli Sinqana.